webinars where we've organized for you in the series of the Eyes Wide Open. So welcome. We're glad that you're able to join us today. With us this afternoon is Dr. Trevor Corneil, who's the Medical Health Officer for Interior Health, and he joins us today from Kelowna, BC. So welcome, Trevor. We're really glad you were able to join us, and thank you for presenting today. We're really looking forward to it. If people do have questions, we are going to ask that you write them in the chat room on the screen to your right, and then after Trevor has presented, we will pick those up and give you the chance to ask Dr. Corneil yourself, or we'll be able to ask those questions for you. Just a couple of things. I want you to know that today's recording, we are recording, so it will be posted later on the website www.preventingcrime.ca. So just to let you know that. Currently, all participants are muted, but during the Q&A, we have the ability to unmute so you can ask some questions in person. So that would be great. So I think right now I'm going to give my controls over to Dr. Corneil. So welcome.
Thank you very much, and I'm glad to be able to participate in this series because I think the topic of opiate prescription and chronic pain and issues around illicit use and overdose are very topical, and we seem to be at a bit of a crossroads where there's acknowledgement that we are in fact able to decrease dose being used, but that we still find there are people who are overdosing. So we were informed by our provincial coroner that in fact there was an interesting subgroup of people that were overdosing accidentally, non-illicit, prescribed, and that this number was higher in interior health. So that gave us a reason to explore this a little bit further. So we did a retrospective case series on all of the coroner files to see what we could find, if there was anything in there that we could use that would be helpful in preventing future overdose deaths. So to give a bit of background in British Columbia, about a fifth of BC residents suffer from chronic pain, and that's defined as chronic pain that persists beyond normal tissue healing time, or about 3 months. And that's consistent across Canada, that number. Of those, 1/3 seek medical or, in particular, physician care in this province. And of those who seek a physician, 50 to 60% are prescribed an opioid for their pain management. In Ontario, there was a recent study that showed it was a little higher than 60%. So we see how important opiates are for people with pain. When you actually crunch that to raw numbers, you see that on these results, we have about 25,000 people in the interior part of British Columbia who are on opiates for chronic pain. That's out of a population of 700,000, and that's pretty significant. What we also noticed was the rate of accidental overdoses per year, which ranges between 70 and 80, was actually the same as the number of deaths from motor vehicle accidents or incidents involving alcohol, which runs about 80 to 90 in the province. So you can see how much airtime motor vehicle incidents and alcohol get, and how much non-airtime people who are being prescribed appropriate doses of medication and opiates are getting. So this slide shows a bit of the background. It's divided by the health authorities, the 6 in our province, and you can see we're the orange line. So we were high in overall, higher than BC, and we were also higher in most cases. There were some periods where where there was not a significant difference, Northern Health, and also on the island. So we are trying to sort out what that is. And the N of 22, that shows us that there are 22 people in a year, or at least in 2009, who died accidentally from a prescribed overdose in interior health. So that's about one person every 2 weeks, which is really significant. So we did do a comparison, and as I said, we were higher than BC, BCH, or Vancouver Coastal Health, and the Fraser Health region, but there was some difference with the others. So the purpose of our study was to explore what associations and risk factors contributed to the increased rate of non-methadone prescription opiate overdose in our region, with the idea that this in fact would give us a window or an opportunity to look at this data across the province. So the main questions we asked were, who is it that are actually dying accidentally or overdosing accidentally from opiates? How, so what is contributing to this rate, and why IH, which is really a difficult question, an interesting one. And then, of course, most importantly, what can we do? Is there anything that we can do to prevent this? What public health measures can we implement to prevent this? And as I said, we did this through a retrospective case series of the Coroner files, and these were based on standardized BC Vital Statistics certificates, and then a review of all of the contextual and Coroner documents and notes that were available. And then we did do some medication profiles that were available in the files, more as an external validator to what we were finding in some of the toxicology, where we draw the majority of our conclusions. So the case definition was from the coroner themselves. They actually had to have said that the person was thought to have died from a prescription opiate that was non-illicit and not methadone. So it was their case definition, and then we used that to dig into the cases. So what we found was interesting, that the number of females were the same as the number of males, which is different than the literature. That 87% were between 20 and 60 years old, which is very young. Most people actually prescribe these deaths to older people, and in fact that's not what we were finding. When we looked at our geography, and here's a picture of the interior of BC with Shuswap, Okanagan, and the Kootenays, we found that it did not matter where in interior health we were, but we were finding the same results. You do see some hot spots, and those actually match the population, so where most of the population lives. As I said, the different areas within interior health had a similar rate of death. But what was also very interesting is that urbanity, or rural versus urban, did not make a difference. Many people and many studies will either ascribe overdose deaths to more rural areas for certain reasons, or to more urban areas for other reasons. But we were able to show that
Dr. Corneil, we seem to have lost your sound.
that was not the case. 85% in fact were accidental. Chronic pain we found in 82%, and that really was confirmatory. There are very few other reasons that anyone would prescribe a non-methadone opiate. So, or at least within what are considered standard care guidelines for other disorders such as substance abuse or dependence. So that just confirmed that yes, opiates were being used for chronic pain. Similar to the literature was that about half were suffering from a comorbid psychiatric illness. And this was actually where we started to get interested, is only 25% were actually on a high dose of opiate. In other words, in reviewing the files, the majority of people who overdosed accidentally were actually on 200 milligram equivalent oral morphine or less, which means that for the most part, the physicians were actually applying recent guidelines for back pain and for chronic pain and for neuropathic pain. What was also interesting, and again different from the literature, was that 80% of people, or over 80% of people, were actually working versus unemployed. So we have a young group of people who are actively working who are overdosing accidentally. And some of the pictures were quite disturbing. For instance, people keeled over beside the stove and you could see the food being cooked. Clearly something had tipped them over the edge and they had stopped breathing or their body had shut down. One point to make was a lot of people ascribe high rates to Aboriginal populations. In fact, that was not the case. We only had a couple of cases where people were status